Deepali Khanna. I'm the Vice President with the Rockefeller Foundation looking after the Asia region. I'm based out of Bangkok and I've been doing this work for the last 8 years. The importance of rural healthcare and how do we build a very strong health system which is kind of equipped to deal with the local realities is going to be absolutely critical. There's no way that we can let the rural populations be left by themselves to take care of themselves, or have them come to tier 1 cities, tier 2 cities, or the nearby towns, because as it is, we are seeing there's just so much of a demand within the existing health systems in these peri-urban and urban centers. And also trying to really focus not just on the curative side but on the preventive side. And there are many examples from India which really speak to that, which have been very, very successful. Also globally, there's a lot that other Asian countries, Africa in particular, can learn. And also India is obviously trying to see how it can learn from the best practices from other countries as well. So post-COVID, I think one of the things that we've all realized is that our health system wasn't really geared to meet the challenge. The health infrastructure, whether we look at it at a global level, whether we look at it at regional level, national level, and hence even at the local level, it wasn't really strong enough. We didn't have the necessary testing abilities, the diagnostic capabilities, the capacities and the capabilities to really address these issues. So post-COVID, I think there's definitely a realization and an alarm bell that has been rung that we really need to be doing all that we can to really start from the local level and really see how we can ensure that our communities, our local communities, vulnerable communities, have access to health systems in real time, so that you don't come to a place where the system just chokes and just falters away. So I think post-COVID, more of a realization around the needs of strengthening our rural health systems, really building more capabilities and capacities, because for example in India, the ASHA workers and the Anganwadi workers have done an amazing job, and I think the kind of community health infrastructure that India has is pretty amazing. But how can we digitize that further? How can the Anganwadi workers, the ASHA health workers have access to the analysis of the data that they're sharing at the district level, at the state level? So there's a lot we've learned, but a lot more to learn. But I feel very encouraged with the steps that the government of India is taking to really make this a top priority in everything that it's trying to do to really ensure the well-being of its population across not just the cities but in the hinterlands amongst populations that need it the most. The Rockefeller Foundation, we're a 110-year-old foundation whose vision has always been to serve the well-being of humanity. We have done significant work in the public health side. So, whether it was setting up the All India Institute of Medical Sciences or the Institute of Virology here in India, or in Thailand setting up the Siriraj Hospital or the Mahidol University, or even in China, the Peking Union Medical College and Hospital. These are all iconic centers that have become centers of excellence. So looking at the diagnostic side, there's so much of possibilities to indigenize a lot of the diagnostics, and we did a 1.0 series, and now we've just launched the 2.0 series, where we really want to be seeing how the diagnostic capabilities are built, how people have access to the tools so that quick decisions can be made in terms of curative and preventive services. So our effort is really to make diagnostics affordable, accessible and equitable to the vulnerable populations. So I think we are all seeing the impact of climate change. We are all seeing, like I myself am personally shocked when people tell me that there are dengue cases in a place like Missouri. We've never heard them before, and people are not making the connection between climate and health issues. So we at the Rockefeller Foundation have really started looking at the intersectionality of how climate change is affecting people's lives, and in particular when it comes to health issues. So we are really looking at the kind of patterns of dengue that are emerging, and what is happening with the heat waves, with the flooding, etc., and what can we be doing so that people are a lot more aware around the issues that are knocking at their doors, because that's not something that would happen automatically. We're also doing a similar pilot in Brazil as well as in Bangladesh. So we really want to see what we learn around piloting something where we deliberately looking at the intersectionality of climate and health. We're being more intentional about it, what we would be able to learn, so that we can have a playbook for the rest of the countries to be able to adapt, adopt, and really be able to front and center tackle the climate change and health issues that are right at our door. I think one of the things that COVID has also taught us is that we need to collaborate. The only way we will be able to deal with any pandemic, even now when the pandemic is not over, but to be better prepared for any future pandemic, we need to be collaborating. What I mean by collaborating is that we can really have a safe space where we can get all the right actors to be able to share, learn, build trust, just not talk about the wonderful things that each one is doing, but what hasn't worked for us, so that we can really be nimble and agile to be able to be better prepared for any future health emergencies. And this is why we, the Rockefeller Foundation, who felt that getting this kind of a global learning collaborative in place would really be important. We've provided a seed grant to Access Health International. I'm also very glad that not many times when these global learning collaboratives are launched, they're launched from the global north. We have here India, Access Health International, based out of India, leading this global collaborative. So getting all the global actors and really prioritizing the global south actors, but not just limiting it to that, because we don't want to have an exclusive club of the global south. We want to pull in the global north, but we want them to come in with humility to also learn from us rather than tell us what needs to be done. I think that's one of the things that one is always worried about, where people coming from outside the context in which we're kind of living daily will come and tell us what needs to be done. So we're very excited about this opportunity with Access Health International, where we can really be promoting a learning community that can really not just be talking to each other, but leading towards concrete action, where they're building on the strengths of each other rather than having to do it alone. I think the only way we can really work towards addressing any future health crisis is going to be through collaborations that are nimble, agile, effective, leading to action. So we're very excited about this collaborative that we've seeded with Access Health International.